Hi. My name's George. I'm one of the nurses in the day stay unit. I've come to talk to you about the lumbar puncture you'll be having this afternoon.
Thank you. I'm a bit worried about it. I don't know whether I'll cope at all.
That's okay. It's normal to feel apprehensive. It's not a painful procedure, but it can be uncomfortable. It takes around 20 minutes. I'll stay with you the whole time to support you through it.
Thank you. I feel better about having the lumbar puncture now.
I'll go through some information about the lumbar puncture with you now, so you'll know what to expect. During the procedure, a sample of cerebrospinal fluid will be taken from your spine. It will be tested for bacteria or viruses that cause brain infections like meningitis.
I see.
Before the procedure starts, I'll get you into the correct position. You'll be placed on your side in a curled up position. I'll help you to draw your knees up to your chest. Then, I'll move you to the edge of the bed, so the spaces between your vertebrae are as wide as possible. That makes it easier to insert the needle into the right space.
Okay. And you said you'll stay with me, right?
Yes. I'll stay with you during the whole procedure. I'll help you keep your neck tucked into your chin and your knees flexed. I'll also be watching for any signs of distress, such as lightheadedness or severe pain.
That's reassuring to know. Can you explain again what will happen during the procedure?
Sure. A lumbar puncture is a sterile procedure, so your lower back will be cleaned with an antiseptic solution first. Then, a small amount of local anesthetic will be injected into your lower back to numb the area. It may feel like a burning sensation, but this is quite normal. After a few minutes, the doctor will put in a special needle into the space between the fourth and fifth lumbar vertebrae. A sample of cerebrospinal fluid will be taken out and sent to the lab for testing.
What happens after that?
The needle will be removed and a small dressing will be put on the lumbar puncture site. You'll lie flat for 1 or 2 hours after the procedure, and should also rest for the following 24 hours.
Are there any complications I should be aware of?
It's quite common for patients to have a headache after a lumbar puncture. Drinking plenty of fluids and taking simple pain medication will help with this.
How long do the headaches usually last?
Post-lumbar puncture headaches can continue for a week or more. The headaches are generally worse when sitting or standing, and better when lying down.
What about getting back to normal activities?
It's important not to do anything strenuous, like heavy lifting, until you feel well enough.
What do I have to do about the dressing on my back?
You can take off the dressing when you go home. If the puncture site is bleeding, or leaking clear fluid after a week, you must report it to your doctor.
All right. I'll keep an eye on it and phone the doctor if I notice any of the things you warned me about.